COVID-19 infections will increase significantly in Gauteng. That's according to Premier David Makhura. Some hospitals in the province are already struggling to deal with the high volume of patients. The government says it's in talks with various vaccine suppliers. So joining us to discuss these issues is health specialist Professor Alex van der Heever. Very good morning to you, Alex. Let's talk about the infections, the amount of people heading to hospital. What are we expecting here, and are we prepared in any way?
Well, we're expecting there to be a very significant increase in the number of patients in Gauteng, and still continuing to increase is KwaZulu-Natal. Whereas Western Cape and Eastern Cape are sort of stabilizing. So I think that the difficulties are going to continue in these two sort of bigger provinces, also because they tend to take patients from other provinces as well. So I think things are going to get quite difficult in the next week or so, in a couple of weeks.
Any idea when this is likely to plateau, or is it just going to get a lot worse before we see the light?
It's difficult to say, because the peaks in the surges in the different provinces have been higher this time around, at least in terms of the cases that have been detected, than they were in the first surge. So Western Cape was significantly higher, and Gauteng in the first surge was about sort of 3 to 4 times higher than Western Cape. So at this point in time, the increases are not slowing down when looking at a sort of 7-day moving average, which eliminates the sort of bumpiness in the reporting, and that remains worrying. So it's unclear, but what we do have is to take note of is that the restrictions came in a couple of weeks ago, and we're probably still waiting to see that come through in the figures, because what we see on any particular day, or even in the average, is sort of roughly what occurred about sort of 7 days ago.
And Alex, have we learned more about how the virus works? And I mean, for example, quite a few members of my family got affected. The healthiest member of our family is in hospital at the moment on oxygen, and he's really struggling. And I believe it's all about viral load, isn't it? I mean, knowing that, how do we deal with that? I mean, are there new procedures in place? What more have we learned about the way it works?
Yeah, so it's difficult. I won't sort of talk to the specific clinical aspects of it, but I think that people have, the clinicians have indicated that they know a great deal more about treatment, provided that people come in early when the sort of oxygen levels start to decline. So some people come in very late in the day, and that makes it quite difficult to provide the treatment that will sort of impact on them. But between the people who are healthy and who suddenly get severe illness, and those who appear to be sort of less healthy and don't get severe illness, I think that's part of the law of averages. You're going to have some people where their susceptibility is to severe illness is probably related to some unknown physiological features, and that not everything is known. And I think people are still trying to discover exactly who develops severe illness and who doesn't, other than the sort of statistical average type.
Okay, so we wait for the vaccine. We're looking at different parts of the world. What do we know about the vaccines that would be best suited to us, for us?
So a number of vaccines have been approved internationally. There are two things that people look at coming out of the clinical trials. One is safety, the other is efficacy. Efficacy is how well the vaccine will impact on, will provide immunity, how well it does that. Although there's not absolute sort of conclusive evidence, there's enough evidence that emerges from the trials to draw a reasonable conclusion that you've either managed to reduce, let's say, be immunized against being infected, but also, even if you do get infected, that you do not get severe illness. So in the vaccines that have been approved, all of them have proven to be efficacious and safe, which is the Pfizer vaccine, Moderna vaccine, as well as the AstraZeneca vaccine, of which some will arrive in South Africa hopefully this month and some next month. But
excuse me, jumping in here, where's our vaccine? What's the hold-up there?
Yeah, so this has been the subject of a lot of criticism, because South African government appears to have been very slack in initiating bilateral negotiations for vaccines for early delivery. It appears they were very hesitant to enter into any kind of arrangement last year, and I think that's put us in a great deal of difficulty. So a lot of countries went and negotiated to at least get a sufficient number of doses to begin a major vaccination strategy in the beginning part of the year. South Africa didn't do that, and only under pressure has it just entered into some arrangements now with AstraZeneca. But they also have to enter into arrangements with Johnson & Johnson, whose vaccine is being produced in South Africa, at least the final phases of it. And it's astounding that we don't have an arrangement with Johnson & Johnson, whose production process even will be in South Africa. And you know, it'll end up us having sort of 300 million doses of vaccine flying into South Africa, being put in vials and then flown out again. So South Africa has to enter into an agreement with them, and probably one other producer as well, to get us to the levels at which we have to have herd immunity. But AstraZeneca vaccine would be a very good one in South Africa, as well as Johnson & Johnson. So both of them have sort of normal requirements for managing the cold chain. In other words, the refrigeration requirements are appropriate for the kind of refrigeration that we have in South Africa for existing vaccines. And we really should be prioritizing getting these vaccines now booked for doses to arrive all the way up to herd immunity. We need to get on with it, but it's unclear where government is at this point.
Alex, thank you.